Hello and welcome. Today, we're diving deep into a fascinating and sometimes perplexing condition, sarcoidosis. Specifically, we'll be exploring how this disease can affect the nervous system, leading to a range of neurological challenges. Join us as we uncover the causes, symptoms, diagnosis, treatment, and more to gain a better understanding of neurosarcoidosis. The exact cause of sarcoidosis remains a mystery, and this holds true for neurosarcoidosis as well. It's believed to be an immune system disorder triggered by an unknown substance. This substance, which could be an infection, chemicals, dust, or even abnormal reaction to body's own proteins, provokes an inflammatory response in the body. Genetic predisposition is also thought to play a role, meaning that some individuals may be more susceptible to developing sarcoidosis if they have a family history of the disease. But to be clear, sarcoidosis itself is not contagious. Let's delve into the pathophysiology of neurosarcoidosis. Sarcoidosis is characterized by the formation of granulomas, which are clumps of inflammatory cells. In neurosarcoidosis, these granulomas develop in the brain's spinal cord, meninges of the membranes surrounding the brain and spinal cord, or even peripheral nerves. These granulomas can disrupt normal nerve function by compressing or directly infiltrating neural tissue. The inflammation associated with granuloma formation can also damage the surrounding tissues, further contributing to neurological dysfunction. The specific symptoms experienced depend on the location and size of the granulomas and the extent of inflammation. Sarcoidosis is a relatively rare disease, and neurosarcoidosis is an even less common manifestation. While it can affect individuals of any age, race, or gender, it's more frequently diagnosed in adults between the ages of 20 and 40. Interestingly, African Americans are more likely to develop sarcoidosis than Caucasians. The exact prevalence of neurosarcoidosis is difficult to determine, as it's often underdiagnosed or misdiagnosed due to its varied and nonspecific symptoms. Research is ongoing to better understand the epidemiology of this complex condition. The signs and symptoms of neurosarcoidosis are highly variable and depend on the specific areas of the nervous system affected. Common symptoms include headaches, seizures, facial paralysis, Bell's palsy, vision changes, cognitive impairment, weakness or numbness in the limbs, and difficulties with balance or coordination. Some individuals may experience psychiatric symptoms such as depression or anxiety. Cranial nerve involvement is quite common. Because the symptoms can mimic other neurological conditions, a thorough evaluation is crucial for accurate diagnosis. Diagnosing neurosarcoidosis can be challenging due to the nonspecific nature of its symptoms. The diagnostic process typically involves a combination of neurological examination, imaging studies, and laboratory tests. MRI scans of the brain and spinal cord are used to visualize granulomas and other abnormalities. A lumbar puncture spinal tap may be performed to analyze the cerebrospinal fluid for signs of inflammation. In some cases, a biopsy of affected tissue, such as a lymph node or nerve, is necessary to confirm the diagnosis. It is also important to rule out other conditions that can cause similar symptoms, such as infections, tumors, and other autoimmune diseases. While there aren't distinct classifications or types of neurosarcoidosis in the same way as some other diseases, it's often categorized based on the location of granulomas and the specific neurological manifestations. For example, we might talk about cranial neurosarcoidosis affecting the cranial nerves, spinal neurosarcoidosis affecting the spinal cord, or meningeal neurosarcoidosis affecting the meninges. Understanding the specific pattern of neurological involvement helps guide treatment strategies. The primary goal of treatment for neurosarcoidosis is to reduce inflammation and suppress the immune system to prevent further damage to the nervous system. Corticosteroids, such as prednisone, are the first-line treatment for most patients. Immunosuppressant medications, such as methotrexate, azathioprine, or mycophenolate mofetil, may be used in conjunction with corticosteroids or as a steroid-sparing agent. In severe cases, biologic therapies such as TNF-alpha inhibitors may be considered. Physical therapy, occupational therapy, and speech therapy can help manage symptoms and improve quality of life. Regular monitoring is essential to assess treatment response and manage potential side effects. Unfortunately, there's currently no known way to prevent sarcoidosis, including neurosarcoidosis. Because the exact cause remains elusive, preventative measures are difficult to implement. However, individuals with a family history of sarcoidosis should be aware of the potential risk and promptly seek medical attention if they develop any concerning symptoms. The prognosis for neurosarcoidosis varies depending on the severity and extent of the disease, as well as the individual's response to treatment. Some individuals experience complete remission, while others have chronic or relapsing symptoms. Early diagnosis and treatment are crucial for improving outcomes and preventing irreversible neurological damage. Recent research has focused on identifying biomarkers that can help predict disease progression and treatment response. Advances in imaging techniques and targeted therapies are also offering new hope for individuals with neurosarcoidosis. Researchers are actively exploring potential therapeutic targets and developing novel treatment strategies to improve the lives of those affected by this challenging condition. Thank you for joining us on this informative journey into the world of neurosarcoidosis.